Hey guys, welcome in. Welcome in, welcome in. Happy Saturday, all. How are you guys doing? Welcome in, Martha. How is everyone doing? Just give me a second. I'm just gonna turn on a few things here. How's everyone doing today? Welcome in, guys. I'm gonna give it a couple minutes to let people come in and join us so we could chat about GLP-1. How are you guys doing? How's your Saturday? How's everyone doing? Thank you so much for joining me. My name is Colette. If you're new here, I'm on my GLP-1 journey. So welcome in, guys. Welcome in. Welcome in. Thank you so much for being a part of my community this morning. It is afternoon. It is 1:20. So thank you so much. Hi, Elket. Welcome in. Keep tapping the screen. Just going to give it a few minutes to allow more people to join us. Hey, Nidhi. How are you, friend? Happy Saturday to you. GLP-1 Crystal, welcome in. Thank you guys for being here. Good afternoon. Good afternoon. Thank you so much for joining and hanging out with me this Saturday. I have missed you guys. I have not been on since, what, Wednesday? Yeah, Wednesday was the last day I went live. Live has been lifing, you guys. How are you guys doing? Let's chat. How was your journey? How is all things? How are you, Nidhi? It's good to see you. Nidhi, you came up as one of my friends on the Book of Faces. Should we say that? And I'm just going to follow you or request you to be a friend because, yeah, we are friends, right? It's interesting how even though it's two separate platforms, it kind of still sort of talks to one another, right? I don't know. It is interesting. I just find... I find all of these platforms fascinating. Still kind of learning a lot about, functionalities and stuff, but it's really interesting. All that to say is that you came up in the Book of Faces, and I will make sure I request you as a friend. So welcome in, guys. Welcome in. Good afternoon. Let's keep tapping the screen. Let's get more people in the room. I just was holding some time for us to just chat a little bit. I have not been here in a couple of days, so just wanted to connect and see how everyone's doing. Thank you for the repost, JLux. How are you? It's good to see everyone. How are you guys doing? Really? How are you doing? I want to know. I want to know all things. Thank you so much. Thank you for that. Let me turn this down a little bit. I do like to have some music playing in the background, but I also like to hear myself. Thank you guys for being here. Welcome in, welcome in. How are you guys doing? Honestly, I just want to hear how everyone's doing. Thank you so much for the popular, JLux. Thank you, Shay, for the follow. How is everyone doing, guys? My name's Colette. I'm on my GLP-1 journey. I do like to come on to share my journey and just to hang out and answer questions if people have it. If you're new to our community, a GLP-1 community, welcome. We're so happy to have you here, guys. Thank you so much for all the taps and all the shares and the reposting. If you could share the live with 4 people, I'd appreciate it. Let's get more people in the room so we could chit chat. So share to 4, repost. JLux, thank you for doing that ahead of time. And tap the screen. So like I said, I'm Colette, and I have been in my journey for 20 months. I've lost 45, 46 potatoes, depending on the day. But you know what I was just noticing, even though I haven't been on the scale for about a week now, is that I've been in the same loss for a couple weeks, right? I'm not too concerned. I know I'm still doing other things, and I'll just keep watching, maybe step on the scale next week and see how that goes. But I'm not too concerned, right? Because I know I'm doing all the things. Kimberly, you're down 20 since November. Wow, November. That's great. So that's been a couple months. That's great. Good for you. Most side effects are gone. Crushing right along. I love that. That's great. Thank you so much for sharing. Good. What are you on? Can I ask? That's amazing. Thank you for sharing that. Who else has something to celebrate? It doesn't have to be, skill related. It could be an NSV. Let's share it. Let's share all of the wins and use a 432. You have been, oh no, every day. That's not good. So what I will ask you to do is go in to be seen. Okay. So thank you so much for the heart me. I appreciate it. Thank you so much. So what I would say, if you find yourself constantly going that way or the other side, you want to go get seen, because what happens over time is that you start losing electrolytes. That's not good. So please go into the nearest care center, whether that's a hospital or after hours, if they have it in your area, be seen. That is not good. Okay. If you can, and you can take electrolytes, supplement with that, drink enough water, but please go in and get evaluated. That is not okay. Kimberly, what about compound sema? I think you may have said something about that. Are you asking if that's okay? Kendra, thank you so much for the heart me. I appreciate it. I've lost all my weight so far in 0.5. That's good. Yeah, you don't have to be on a huge dose to lose potatoes on these meds. As long as you are showing progress, that's fine, right? So that's 1 to 2 every month. If you're losing that, that should be great. Oh, that's so awesome. Thank you so much for the hearts. That's so beautiful. You asked me what I was on. Okay, yeah, that's good. Yep, thanks for the response. That's good. 0.5. Wow. It's good. Yeah, it looks like you have responded really well to it, right? 20 in 2 months. Yeah, that's quite a bit. That is quite a bit. So that's good. And you're probably a little bit over the sustainable goal, right? So 1 to 2, but you're probably about 2.5 or so, which is great. I love that for you. So I would just stick to that same dose and not go up any further than where you are. So I love that for you, Kimberly. That's awesome. Thank you guys for being here. If you're just joining, my name is Colette. Welcome to a safe space where we talk all about GLP-1. So let me know if you're new. I'd love to welcome you. I am on my journey as well, and we just come in here to chat, share our wins. It doesn't have to be skill related. It could be non-skill victories too, and we like to celebrate those as well. Sandals Claus says, I lost 14 in 2 weeks. Okay. Mostly water from your legs. You have lymphedema. Makes sense. So the one thing we know for sure is that these meds are pretty good of ridding our body of that excess water. So that's what it does very well. So a lot of times when people get started, they lose a ton and they think, oh my gosh, that's a lot. It does slow down over time. It's usually not at the same rate, but that makes sense that you would lose 14 in 2 weeks. So I love that for you though. I bet your legs feel better, right? Yeah, that's good. Hey, Christine, how are you? It's good to see you. Welcome in. Welcome back. Thank you so much for stopping in. So we're talking all about GLP-1. Kendra, thank you. Fellow nurse, thank you so much. We're talking all about GLP-1s. We're talking about our wins. We're sharing all the things. So please ask your questions. I do like to hold space, just for that, to come in and not feel judged and ask your questions so that we can answer them and steer you in the right direction, and even share your wins too. Those things are all good. They're uplifting. Spiral says, any suggestions on how to deal with hair loss while using GLP-1? So I would just say make sure you're eating enough. Eating is important, especially your protein. Make sure you're getting enough protein. That's essential. Your hair follicles actually depend on it. So just make sure you're eating enough, getting protein in. I would suggest supplementing with collagen if you don't already do so. I would highly suggest the Neocell collagen because that's the one that I use. Protein is crucial. Make sure you're eating enough. Don't skip your meals. These things will help you. And if you're losing a ton very quickly, that might be the reason. And once you stabilize in that 1 to 2 range every month, you're going to be, not month, every week, you're going to be okay. So what happens is our hair follicles get pretty stressed when we're losing a ton of weight, and it just responds that way. And the follicles go to sleep. It's called telogen effluvium. It's not like it's gone forever. It will return once things stabilize, but do those things and see if it helps. Such a relief. That's good. Mia says, I'm a stone away from your goal. That's awesome. But WL is taking long. So, hey, slow and steady wins the race. We talk about this all the time. The goal is not to lose a ton too quickly. It's best to just be more sustainable. You're going to avoid hair loss. You're going to avoid a lot of other things, right? Muscle loss and all that kind of stuff. You want to, slow and steady is the best. So you're 15, you're a stone away, which is 15 potatoes away. You're going to get there. Just dial in what you're doing. You're going to eventually get there. Okay. There's no need to expedite it. You're going to get there. Okay. All right. Thank you so much. Kendra says you just reached fan level 4 in the fan club. So thank you so much. Thank you. All you guys, keep tapping, keep inviting, keep sharing all the things. I appreciate you guys. You know, not being here for the last 4 days, I've really wanted to come on, just didn't have the time. So I'm really happy that I have some time today to come on and hang out with you guys. This is really fun. Water72 says, hi Colette, I am on summer now, lost 25. How do you decide to switch? How do you decide to switch to TERS? Do you need to switch to TERS? That's the question, Water72. If you're losing on SEMA, there's really no need to switch. I don't think the decision to go to a different form of GLP-1 is necessary as long as you're getting the results, right? So if you are losing 1 to 2 every week, that's sustainable loss, and you should just keep on with the medication that you're on, okay? Except if you're experiencing side effects, or like unwanted side effects, or you're not responding to it, right? That's when I would say it's okay to switch. Where can I get collagen supplements? You can get it right here in my shop, okay? And I'll put the name there too, just so you have it, because a lot of people do like to so it's in the it's the #1 best-selling collagen. I'll just pin it just so you see what you know what you're looking for, right? I'm gonna pin it here if it lets me. There you go. Okay, there you have it, and you can find it in my TikTok shop. So there is no reason to switch if you don't need to. Can you take Wegovy 1.5 pill with berberine? I would ask your doctor that question. I know some people do take berberine for other reasons, but I would just make sure that the doctor is okay with it, because even though those are natural supplements, right, it's important that you're checking in with your provider before using that. Cooking with Mass, how are you? Welcome in. No loss for 2 months. Okay, Water72, I see. So 2 months. So let's talk about it. So you have not lost anything in 2 months. Well, why do you think that is? And I ask this question because that's the question that I want everyone to always ask themselves once you find that the scale is not moving the direction that you had hoped for, is to ask yourself, is there something that I'm doing that I have, is there something that is different from what I did when I first started my journey? It's important to ask that question because, it's sort of the self-reflection, right? Like you want to make sure that you're really checking all the boxes, because a lot of times what it is that we have deviated from what we used to do. That's what we find. So that has to do with your eating habits, your water, your exercise. All those things count, and that might be the reason why you're stalling. It's not to say the stalls are not it's not natural to occur. It does. It happens in this journey. We know that, which is why we try to do other things. But the first thing I would ask you is have you deviated from the things that you used to do? So make sure you're tracking everything. And I know it's not the word that anybody likes to hear, but track what you're eating, make sure you're getting enough sleep, make sure you're exercising, moving your body at least 30 minutes a day, make sure those things are going the way that it did when you first started. And if that's the case, then maybe try other things like switching injection sites. Then yeah, I would move up in those, especially if you have tolerated, Water72, I'm talking to you, especially if you've tolerated the SEMA, I would just maybe go up in dose, right? I don't know what dose you're on. You probably mentioned and I just forgot. Maybe try that. right? If all else fails. Yeah. So, your favorite career advisor, Sherry or Sherry or Sherry? Did I read that right? I'm not sure. Hello. How do you get the weight loss medicine? Do you have to be prescribed? It has to be prescribed. So with Join Fridays, providers actually do prescribe the medication. So it's nothing you're getting online. You will have to meet with a provider, and then they do the assessment after you've completed your quiz, and then they prescribe your medication, send it to a compounding pharmacy, and then the meds comes to your home within 5 to 7 business days. So if that's what you want, I can help you with that. Okay, just send me a message. Absolutely, I would love to work with you. Let's see. Would it affect fertility? Lauren, if anything, it helps with fertility. From what I've heard, does the GLP-1 pill work for anyone? So Bonnie's asking. I know a lot of people. So Rybelsus has, historically was the oral GLP-1 that was utilized before the Wegovy pills just became approved a few weeks ago. But some people, it works for them, and others not so much. But I think it's worth trying, especially with the Wegovy. Is it normal? What's normal lifestyle? I think I missed the question, or maybe Lauren, excuse me. Let's see. I'm getting my questions mixed up here. Would it affect fertility? So like I said, it will help fertility. So lifestyle, okay. Lifestyle Nomad says, is it normal? Is what normal? Because I did not see that question at all. And now we have a flash goal. So let's participate in this flash goal. Okay, ice cream cone. Okay, guys, there it is. If you could send one each, that would be great. Thank you, thank you. Let's see. So beyond Size Plus. Thank you so much, Kendra. What can I do with hair loss? So hair loss, here's the thing I say about hair loss. Make sure you're eating enough. Don't skip your meals. Eating is important. We got to make sure we're staying nourished in this journey. So eating is essential, especially your protein. You want to make sure you're getting your protein in, okay? So get your protein in. Your hair does require protein for growth. So protein is essential. Supplement with collagen, and I just put the collagen that I would recommend. You can find it here in my TikTok shop. It is the #1 best-selling collagen, you guys. It is right here. I take it every day, so I would recommend that. If you are losing a lot, I would maybe try, if you can, to slow down, because that oftentimes is one of the reasons why we lose hair. But certainly eating and supplementing with collagen is I would advise that you do that. Make sure you're taking a multivitamin, which should be standard regardless, right? The other things that you can try, there are things that you find here in the TikTok shop as well, like the Hair Factor is one, or the Mary Ruth Hair Vitamin. Those things work. A lot of people do report a lot of good results from that. So those are my suggestions. Okay. Oh, you got pregnant. Leonie just said she was on TERS and conceived. That's very common. We hear all about, our OZ babies, right? That's the general term, but thank you so much for sharing that. Yeah. Thanks for the gifts. Absolutely. You are welcome. Does it eventually come back? What do you mean? Like the potatoes? It could. So the studies, if that's what you're asking, the studies do show that when people are on these meds and they quit, 70% of people will regain. They will regain. So yeah, it does. It can come back. And for the other 30%, you just dial in your nutrition, you dial in all the things that you've learned while you're in the journey, and you stay where you need to be. You don't regain, but 70%, a good majority of people will regain after they stop taking the meds. Yes. You're welcome. Does it eventually come back? I think my very first injection, Leonie says. Okay. The hair. Yes, it will. Absolutely. And Leonie says, I could never get pregnant. See? Hey. There's a reason why we talk about GLP-1. As a matter of fact, for people that struggle with PCOS, right, and get on these meds, they conceive. So it has a way of stabilizing your hormones and helping you conceive. Yes. Is it FD approved? Should I be scared? So Mimi, I would, if you're talking compound, it really depends on where you're getting it. And I would be careful as well. As a matter of fact, I will be scared as well if you're getting a compound form of these meds. You want to make sure that you are doing your research. You know, Trustpilot.com is a site, it's independent. You can go in there and do your search and review any pharmacy, or rather any telehealth company that you're working with. I stand by Join Fridays is reputable, and I trust everything that they do. I've been with them for almost a year. So, and gotta stack those habits, Kendra says. Absolutely. So if you're getting your meds online, or you're getting it through a telehealth company, I do encourage you to do your research. Research is important. You're welcome, Mimi. Will they accept insurance? So they don't, because it is not covered by insurance, right? It's not brand. So the compounding medications you can use your HSA and your FSA to pay for it, as well as they just started taking Klarna. So that's another alternative for you. Those are good questions. But yeah, I totally agree with you, Kendra, on the stacking of habits. We have to stack our habits. It's not, the medication is just a tool. It's not the end all be all. It's not going to fix the problem. We have to make sure we're dialing in our behaviors and making sure that we're moving our body. We're making good choices when we eat, things like that, right? That's all important. Hey, Coach Chantel, thank you so much. Thank you for coming in, friend. And thank you for the repost. I do appreciate you. We're just chit-chatting all about GLP-1 health journey. How are you? Welcome in. Thank you for the gifts. Thank you guys so much for joining me and for hanging out with me. I do appreciate each and every one of you. If you're just stopping in, new here, let me know. I'd love to personally welcome you. My name's Colette. I'm on my GLP-1 journey. It's been 20 months. I am on TERS. I take 11.25 of TERS, so I'm sort of on the higher end. Tara, thank you for the heart puff. So I have been on this med for 20 months because I was in a very bad place in terms of my health. I was extremely, just not, the quality of my life just not was where I wanted it to be. So this medication has given me, I always say, a new lease on life, because I can now do more, right? I had to have surgery a couple months ago. I know a lot of you know that are on this live right now. Coach Chantal, you're one of them. But it was just because I had totally destroyed my knees just from being in a chronically obese state, right? So I had to do surgery there, and so thankful. And one of the reasons really why I started my journey was because of the pain that I was living in. Like, I was always in pain. I was always taking meds, trying to dull the pain, because my knee was shattered from just, again, osteoarthritis, which I'm sure there's a genetic component there, but obesity was really the reason, because I was carrying a lot of weight on the knees, and after a while it just wasn't able to to function like it was, or like it was meant to function. So that's why I share my story, because this medication has really been life-changing for me. Let's see. Thank you guys. Thank you so much for sharing and all the things. Stephanie says, can you take it if you're hypertensive? Absolutely. I will answer that without any hesitancy, because I know a lot of people that have had to deal with, or that deal with high blood pressure issues, that have gotten on these meds and have since either dropped their dose, their doctors have, because it's been able to help them control their blood pressure. Because when you really think about it, when you have a larger body, it takes a little more work for your body to eject the blood out of, to your whole system to be able to function. So basically your blood volume is higher. So yes, it does help with hypertension. And talk to your doctor, of course. But does TERS work the same as Zepbound? Yes, it does, Hollywood. It sure does. I'm on TERS 20 units. Else Journey, that's awesome. That's awesome. So that's the amount that you're pulling up in the syringe, but what is your dose? How long is it recommended that you remain on GLP-1? for as long as you need. Yeah, for as long as you need. And everyone's situation is going to be different, right? Because you may need to just lose 20 or 30 or 100, 200, right? So it's as for as long as you need. Tara Ditto, so you can relate. Yeah, absolutely. Living in a larger body and all of the effects of that is not a good thing. I have osteoarthritis and can't wait to be able to walk again. Yes, I miss my independence. Elle's journey, you can do it. You can. Because honestly, it's like night and day. Like walking was a chore for me. It really was, because I was just always in pain. And the one thing I noticed 2 weeks into this med was I had less pain. I mean, given my cartilage was already bad, right? Just because my highest was what, 309? That was, it's really heavy. So my cartilage was already like gone, but the pain that I had related to that bone and bone was so much less once I started my journey 2 weeks in. I had not lost anything, but I could feel the difference in terms of the pain. That was huge. And that's when I made the call. I said to myself, I think I have made the best decision ever. So, and that again was Zepi. That's what I started on, 2.5. And, you know, fast forward 20 months, I still feel the same way. It's been great. It's been good to me. And my insulin resistance is so much less. I'm less insulin resistant because I'm on this medication. So it's just been all good things for me. And it's not just about the WL, it's about the other things that it's done for my body to help me stay healthy. That's me, T, question mark. I don't see your question. So let me just pause and say this. If any of the things you say within the comments violates community guidelines, I wouldn't see it. You may be able to see it, but I don't. So I'm not intentionally not answering your question if that's what you think. LG, so maybe re-ask it again, chunk it out if you can, ask it in 2 parts, use emojis. Sometimes those things work. I was asking advice on going up to 1.0. On SEMA, I'm going on 0.5, 20 in 18 weeks. Can I go up or down week to week? No. The best way that this medication is typically prescribed is to stay on the same dose for 4 weeks. And then if you're maybe not tolerating it, go down. Or if you are doing well, go up, as long as you haven't gotten to your therapeutic dose or whatever it is that you have, that you're working on with your provider. So I wouldn't change dose week to week. That's not a good advice at all. You gave me so much hope, friend. I'm 338. My little legs and knees are over it. The pain. I totally get you. I see you. I get you. I lived exactly like that for a long time, Elle. So hang in there. You got this. You got this. And, to that, I will say to you, Elle, make sure you are exercising. So however, whatever that looks like, it could be just 15 minutes of just moving your body, whether it's standing in place, whatever you need to do, those things are going to help. So keep moving your body. Okay, friend, you got this. 6 weeks down, 5. I feel discouraged. Why? Why do you feel discouraged, Tara? So you are losing at a rate about a little bit over a pound a week. Remember, sustainable goal or sustainable weight loss in this journey is really 1 to 2. So you're right on. I would not be discouraged at all. See, friends, it doesn't help if we think we need to lose a ton very quickly. It doesn't. Actually, there is a lot of truth to losing slowly. You're just going to do better. Your body is going to adjust better, and you're going to be able to sustain the loss over time than losing very quickly. So you're doing good. I would applaud you, and I think you should celebrate that. Let's see. Yeah, Kendra is saying the same. It is great. You're doing well. There is nothing to losing too quickly. There's not a whole lot of gain, right? It doesn't make sense. 1 to 2, as a matter of fact, 0.5 to 2 is the general range at which you should be losing. And at that, you're doing fine, frankly. Thank you guys for hanging out. My name's Colette. If you're new here, I am on my GLP-1 journey. I like to come in and share. I have not been able to go live since Wednesday, so I've been so excited to be here today and to share the space with all of you. So thank you for joining me. Oh, okay, BJ. 30 potatoes in 8 months. These are all good things, guys. That's awesome. Keep tapping on the screen, guys, sharing out the live to 4, reposting. Thank you to those that have done that. Thank you so much. That helps push out the live so we get more people in. Thank you, thank you, thank you. What other questions can I answer? I am also an affiliate with Join Friday. So if you're looking to get started on your journey, you've come to the right place, okay? With Join Fridays, what you get is a robust approach to your health journey. You get the medication, you get the resources for support, all the things, right? You get one-on-one provider visits, you get one-on-one dietitian visits. You don't have to pay anything extra. It's just your one subscription fee every month. Okay, so that's what you get. And that's why I love Join Fridays. Hi, V. Is losing 45 in 6 months too fast? So let me do the math. So you're probably at a little bit over 8 a month, right? No, I think that's fine. That is fine. I don't think that's a problem at all. I don't think it's too fast. Let me do my math though. Let me cross check myself. So 6 months, you've lost 45 potatoes in 6 months. Let's do that. So that's 7.5. So I was pretty close. I said 8. So if you divide that 7.5 by 4 weeks, you're about 1.87. So that's great. So the sustainable loss again is that 0.5 to 2. So you're pretty good. You are doing very well. So that's good. Kudos to you. Let's see. Yeah. BJ, I think I saw that. Let's see. My questions are getting all sort of bunched up here. That is great. Is there a weight requirement? I gained 20, but I quit vaping and my food triggers have spiked. What do you mean a weight requirement? I think it's usually a BMI of 27, but sometimes you can qualify if you're a little less, but you have other comorbidities, if that's your question. But I'm glad that you did quit vaping. That's awesome. Michael says, okay, let's see. I don't know what that is. Thank you guys for being here. Coach Chantel, thank you so much for stopping in and supporting my live. I do appreciate you. All right. Well, welcome. Thank you guys for the tabs and the likes. Again, my name's Colette. Let me know if you have any questions at all. I'd love to answer any questions that you have about GLP-1s or your journey or getting started. I'm here for all of it. I can help you with all of it, okay? How much have I lost? I'm sure you're wondering. I've lost 46, 45, depending on the day. I had to come off the medication for 2 whole months though, so when I really think about it, I've been on the medication for 18 total months because I had to come off because I had surgery. So I had to stay off for 3 weeks before, and then after surgery, I stayed off again just because I was taking certain meds that I could not do my jab for. So for a total of 2 months. But the good thing was my body did a reset. It wasn't by choice. It was just because, I had to do it for surgery reasons. So going back on it again, I'm sure for some of you that saw me afterwards, I did gain, after surgery, I gained 10. So that was humbling because that told me that I needed to be on these meds for a longer period of time. The inflammation was real, but I've since lost all of that. So very fortunate to have access to these meds, you guys. I will never come off of it unless my doctor says I need to. When I hit goal, I will go on maintenance for sure. Daisy says, I was given SEMA and was told to come back in 6 weeks with no explanation. How do I begin? I'm so sorry. You would think more doctors know what to do with these meds, but here's the thing. If it's a primary care provider, they usually don't. Obesity medicine doctors would, and I'm sorry that happened. So If you want to go to my, I mean, you should do this. I've got a couple of videos that I posted on about new to GLP-1. You could go listen to, watch those videos. The one thing you want to do yourself is do your research and understand how the medication works and what it's for, right? You do want to learn about the medication on your own as well. So being that it's sema, typically it's an injection, right? So you're going to do your jab like once a week. So make sure you're sticking to the same time schedule. If you're going to do it in the morning, make sure you're doing it in the morning next week. I would also find out a way to track all that is going on in terms of your jab and how you're responding to it that week after, just to kind of monitor and see how your body is adjusting to the medication. Know exactly what your caloric deficit is, and you find that out by going to the TDE calculator, because you want to be in the deficit on this journey. You want to be able to nourish your body, but you don't want to overeat. So figure out what your healthy caloric deficit is. Find an app like the MyFitnessPal app. I would always recommend that because you don't have to pay anything, and then just track. It's going to give you your calories to consume every day. In addition to that, it would also give you recommendation for protein, FAT, carbs, and so forth. So you need that. 25 to 30 grams of fiber is what you need on this journey, because you want to make sure you are having a bowel movement, right? So fiber is important. Fiber is important to help you also feel full for a longer period of time. Protein and fiber, those two things. And those are the two things you need to prioritize: your protein and your fiber. Your carb is going to be a lot lower, right? Because you don't want to have a ton of carbs, but you need carbs because carbs are important for everyday activity, function, breathing, all the things. Make sure you're moving your body at least 30 minutes a day. Drink your water. I would go with 84 to 100 ounces of water every day at the minimum. Make sure you're prioritizing your sleep, right? And what else? Trying to think. Your mindset, positive mindset, so important. So trust the process, just lean into what the medication is doing, what you're doing, know that this is going to work, and show up 100% every day. And if you show up 30%, that's okay on some days. Just make sure you're doing better the next day. But if you need more information, and then find your people. I always say that, find your people. There's a lot of people here in this community to support you, and always be there, because they will be there for you, right? And reach out to me if you have questions. I'll be more than happy. I think I kind of gave you a lot of information too quickly, but let it digest and then reach back out to say, what did you say about this or that? I'll be happy to answer. And if you have access, lastly, I'm going to say this, if you have access to a dietitian, meet with one. Okay, they know a lot about how to eat, because that's something we struggle with when we start this journey. They're going to be able to direct you the right way. How much is the dose? 2.5 or 5 of Terrace. It's the same thing. So with Fridays, you're never, when your dose goes up, the cost never does. So it's always going to be the same cost. It does never go up. So the prices you listed, a sale or the regular price. So Rosalina, well, I hope I said that right. So it's an introduction price. So basically it is the first month, because you're saving that 150 using my code, right? So that's what you're going to get. If you go on a month-to-month subscription, all you need to add the following month is a 150, right? But if you actually want sort of the same price range, what you're going to have to do is do a longer subscription of 3, 6, or 12 months. That's going to give you closer to that price that I have listed there. I don't have it right on the top of my head, but it's a lot better if you do a longer subscription than the month to month. So this price here is for the month to month. So the first month you get 150 no matter what you do, whether you choose the 3, the 6, or the 12. And then the next month, if you were going to do the month to month, it will be $359 for TERS and $249 for SEMA. Again, if you did the longer subscription, it's going to be a lot cheaper. All right, MyFitnessPal app. Yes, MyFitnessPal. You are welcome, Daisy, and reach out too. I'm here for you. Just reach out if you have any questions. I'm going to put that. It's called MyFitnessPal. I hope it lets me. MyFitnessPal. That's the app right there. And don't use any of the, guys, this is actually my backup. So if you want to follow me there, you're welcome to. But certainly not, don't use any, don't pay for it. Don't use the premium is all I'm trying to say. Because for all the things that you need, you could get it for free. You don't need to pay anything excess. I mean, I don't. Are you visible, D? I see that. I see your visibility now. Did you ask a question prior? Because I don't see that. Yeah, I tell you, TikTok has its way of, yeah, it's interesting. I didn't see any questions. So Paris question, I don't see your question either. So maybe try re-asking the question, and if it's not coming through, send me a DM and I can answer it that way. I'm sorry, but they are filtering quite a bit. So, but yeah. So the MyFitnessPal, for whoever asked, that's the app, and you can. I mean, it should be available whether you use Android or Apple, whichever. So, and then make sure you guys are following me there as well. So D, I do not see your question. No. Yeah, I'm so sorry, D. Yeah, send me a DM. Absolutely. Did you have to start over when you had my Delta doll? I did, because I had been off the medication for 2 months. It was a long time. So 2 months is a long time. So I started at 2.5. Yes, I started afresh, which is fine. I don't think it was a problem, because even at the 2.5, I sort of had the same side effects that I had when I first started. One of them, which is fatigue. So I can't imagine starting like on the top dose. Whew, my body would not have tolerated it for sure. So, yeah, you're welcome. I bruised at the injection site for the first time. Thoughts? Viral, pretty normal, standard. So when we give ourselves pokes on these meds, we sort of puncture very tiny blood vessels as we're going into the sub-Q layer, right? Hey, Kitty. Hey, Slim. How are you? Thank you, guys. So what happens is that in itself causes our body to mount this immune response. Like, what are you doing? What is this, right? That's why you get the bruising and you get the irritation. Well, more of the irritation than the bruising. The bruising could just be because you're going through those blood vessels, and it's going to get better. Maybe, right? But if you bruise easily, you're going to continue to bruise. What I meant more of the mounting of the immune response has to do more with when we first start the meds. And that's why people report the redness, the itchiness, and all that stuff. That's pretty normal and standard. It gets better once your body gets adjusted to it. All right. Kitty, how are you? It's been a minute. Thank you so much for coming in. Slim, thank you. Thank you so much. Let's see. All right. I don't see any more questions. Yeah, I'm doing well. How are you? It's been a while. Yes, I'm doing good. I'm getting better. My knee is healing, all the things. Thank you so much for the repost, Nidhi. Yes, you're welcome, Vero. Absolutely. I'm here to help. And now, Paris, I do see your question, but I don't see the question that you asked. So you're down 92, Kitty. That's awesome. That's awesome. That's amazing. Good for you in 11 months. That's a great response to the medication. That's awesome. I bet you feel amazing too. Wonderful. Thank you so much for coming in, and thank you for sharing. If anybody wants to come up and share their story, I'm more than happy to bring you guys up. Just let me know. I feel better. I have a little more to go, and I can't wait. Well, you're doing great. 90, almost 100 in a year. That's amazing. So Karina, hair loss has to do, Paris, the crying emoji, what is going on? So when you are losing too quickly on these meds, the tendency to lose hair is very high. So one thing I will say to you is don't skip meals, eat sufficiently, make sure you're getting all of your nutrients in. Your body needs that. Your hair needs that, especially your protein. That's also important. I would add collagen as a supplement. I always have done that because it's always helped me. Protein, don't skip it at all. Make sure you get, your hair requires that. It's just a response, a stressful response to your loss, your weight loss. Your hair will grow back. If you're really concerned, maybe add something that has Listrevia. I would, recommend the Mary Ruth vitamin or the hair factor. Those two have been pretty popular in the TikTok shop, and you can find it in my TikTok shop too. I'm not successful with OZ. Share what's going on. Give me a little more information. What makes you not successful with OZ? Can you not do GLP-1 if you have pancreatic issues? Reese, that's a good question. So I would make sure your doctor knows about that. If you are with Joint Fridays, they will ask you those questions. And frankly, if they detect that you have a history or have something with your pancreas that makes you not a candidate, you will not get the prescription. Oh, you did? You added GHKCU? I see. I don't take peptides, so that's a good call out there. That GKACU, I don't take that, but it helps with the hair fall. Okay, thank you for adding that. 5 milligrams. Okay, well, thanks. All right, you guys, what are the questions? Let's take a break and drink some water or drink something. I have my protein coffee here that I'm finishing, and I have water. I also started trying this Bloom sparkling energy drink. It's really good, you guys. So let's drink something. What is that going to be for me? Well, I probably should finish my iced coffee. Okay. D, your skin became very dry after this. What can I say? Oh, to get back the glow. Oh. I'm sure there are a lot of peptides out there. I don't have a lot of knowledge when it comes to peptides, but Slim Science, thank you for the rose. You look fantastic, by the way, that picture. The before and after, I just noticed. So I know that there are things that are out there that helps with the glow. The NAD, the glutathione, I think it's what it's called. And none of those things can I take. And I've heard people talk about the glow and just the youthfulness when you have those peptides, when you can take them. So that's probably something to look into. I can't really provide you any information around that, but make sure you are staying hydrated first and foremost. That's very important. I went to a higher dose and wasn't hungry and just ate little at dinner and gained 2. Ooh, Sandra, are you down now? Did you drop back down? Because that happens. That does happen. What can happen if I... Okay, so Paris with Manjaro suddenly, I think it's just getting chunked to the point where I'm not understanding what you're asking. Just send me a DM. Can you do that? I take TERS and NAD. See? Is that helping you glow as well? I've heard great things about them. Unfortunately, because of my history, my family history, I can't take that because of the cellular regrowth. When I wasn't eating enough, I was not losing. As soon as I upped my calories, I started losing. Absolutely, Kitty. That's good that you're saying that, because I was just going to say that as well. Sometimes when we increase our dose and it suppresses our appetite a lot. And if we're not getting the nourishment that our body needs, our body is going to go into this mode of, we're not sure the next time you're going to feed us. We think we're probably coming up to a famine, and we're just going to hold on to everything we have. So yes, if you're on a higher dose and you find that you're not hungry, you're not eating, if you don't eat on this journey, you're not going to lose. It's just that simple. So that means you need to come down on your dose and get your nutrition in, for sure. That is a good call out, Kitty. Thank you for bringing that up. Do you recommend taking phentermine and Ozempic together? So phentermine does something different in terms of cravings and helping with appetite suppression a different way than a GLP-1 does. So it is possible to have both, right? But it has to be under the direction of your doctor. I know sometimes when people don't have access to, for instance, when my insurance stopped covering GLP-1s, the first question I got asked by my provider is, do you want phentamine? Do you want Wellbutrin? Do you want Contrave? They gave me all these lists because we could cover them, right? Now, when people have cravings, some of those non-GLP-1s can be a way to stack with your GLP-1s, right? But it has to be under the direction of a doctor. I would not do it on my own. So, because phentamine can cause like palpitations, fast heart rates, and whatnot. So it has to be under the supervision of a doctor if that's something that you need. You're welcome. Steffi says, I found out if I eat too little, my weight stalls, but when I eat a little more, my weight goes down. Yes. Isn't that interesting how that happens? Yes, Paris, just send it to me because it looks like I can't see any of your questions. I don't know what TikTok is doing today, but it appears that I can't. So either that or it's been chunked to the point where I don't understand what you're trying to ask. So just send me a message. That works for me and I'll respond. So thank you guys for being here. If you're new here and this is the first time that you come into my live, let me know. I'd love to personally welcome you. Okay. Thank you for being here. Wow, I don't know that I need this extra jolt of coffee, but Cindy, welcome. Where are you listening in from? Thank you so much for being here. Thank you. This is like my second coffee, right? I had like the warm coffee this morning. North Carolina, welcome. Thank you so much for being here. And now I'm having iced coffee. I probably shouldn't drink this because this is another jolt of caffeine. I don't need all that caffeine. I need to drink more water. Are you guys coffee drinkers? Tea? What do you drink? I love coffee. I have to have coffee first thing in the morning. That's a must for me. Then I found these Javi coffee. The caramel flavor one is like the best. So I just mix it up in unsweetened almond milk, throw some ice cubes in there, and I'm good to go. But I think I've had enough coffee today. It's really good stuff though. All right. Oh, you're in the Philippines. We just got the FDA approved for Manjaro. Yes, Dr. Weren't able to. Well, I'm glad that you got approval for Manjaro. The way I look at it is whatever your insurance can get approved, or what your insurance can cover in these things, just get them, right? My first HERS was 1128. I'm down 30. Wow, loads of inches and inflammation is amazing. To prescribe the compounded version, so we go to the gray market. I see. Be very careful out there, though. Just be very careful. Make sure you're getting it from a source that has good, reviews and whatnot. Just because we put these medications in our body and we're not probably sure what the effects could be until like months, maybe years from now. We just have to make sure we're very careful. I'll build up an aversion to my injections. Oh, well, that's not good. So far, I've been using TERS for 4 months. Good, Steffi. That's good. That is good. And for those that don't like jabs, that's why we've got the pill. So you have now the Wegovy option, right? And that has been, good for people that don't want to do jabs for sure. So that's given us yet another option, right? Which is always good. Thank you guys for being here. What other questions can I answer? I am really wanting to hopefully answer questions that people have. So you let me know. So when you go to my bio, there's a couple of videos for those of you that are starting. This is one of them that I actually posted. And then the other one, and it's labeled New to GLP-1 episode 1 and 2. So there's 2 of them. So make sure you go and you watch. And if you have questions, just, reach out. I'd be happy to answer them. Will there be a pill option for TERS? I think just like with anything else with competition, especially with Lilly and Novo Nordisk, I'm sure we haven't heard about one. I'm sure there's one in the works somewhere. But we know for sure that or rather, semaglutide Wegovy has now the FDA approved pill form. So, but I'm sure it's not going to be too far in the future. Isel, that's a very good question. All right. What else? What other questions do you guys have? Ask away, ask away. Thank you guys for being here. Thank you for sharing out the live. We're at 14K. That's amazing. I love it. How come are serious complications so nervous? So Jelly, so complications, I would maybe say side effects, right? Complications are probably things that if we had, I'm thinking of so many things all ahead of time. If we had complications around about these medications, I'm sure we would have stopped. The FDA would have said stop, right? We do know that there are side effects that we have on these meds, just like with any other meds, right? Any other meds, I don't care what it is, Tylenol, anything you take has possible side effects. We do know, however, that if we can mitigate some of them, that we will not have them. So the general side effects, and that's what the choice of words that I'm going to use, not complications. We can talk complications in a minute, but the general side effects of these meds are going to be more GI related. So your nausea, your vomiting, your constipation, bloating, things that are more GI related. If you take consistently your probiotic, it's going to sound like a no-brainer. You're going to hopefully prevent some of those things. If you make sure you're eating enough fiber, for instance, you're going to prevent that from happening. Complications, I would take it a little farther ahead. So if side effects are this, complication is that. It's a little farther out. I would more say things like if you had, like a lot of pain and you just ignored it and never really paid attention to it, because that could be, a complication if you don't deal with it right away. If you, for instance, had like a constipation and just chose not to take care of it, well, that could result in a complication like a bowel obstruction, which could lead to losing part of your bowels. Nobody wants that. If you got, what is the other thing? If you, let's say, too high of a dose of a medication that you were prescribed, obviously that could cause complications. So these things, as long as we're educating ourselves about it and doing the things that we should do to prevent that from occurring, then there's really no concern there. I hope that made sense. That was a little too long, but I had to think about it. You're welcome. So, and the other thing too that I think about is, you have to make sure that when you're making a decision about embarking on taking something new, like a medication or doing anything, you have to weigh the risks versus the benefits. In terms of your health, where are you currently, and where do you hope to be, and could this med help you with it, right? So these are things that you have to really think about. Yeah, I'm glad that helped. All right, what other questions can I answer? Thank you guys for hanging out. What is the weather where you guys are at? It is pretty cold here in Minnesota. I'm in the Midwest. It's like -10. Yesterday, as a matter of fact, I think it was -20 something, but it felt like -40 with the wind chill. Yes. Why is there so many scaremongering story, do you think? Well, because some people, and I'm not saying certain things are not happening to certain people, but people take one event and put it out of context, and then sometimes you're wondering that person, and I'm not saying that there could not be complications happening, that because for whatever reason. But I think if we keep these things in mind and are listening to our bodies, right, that's probably the most important thing you do on these meds, is that you pay attention. And when you start feeling a little awkward about whatever it is, you go in and you get seen. But I think some stories that we read or we see is usually because people are not really paying attention to what they need to do, right? And as a result of it, they have bad complications, and then they generally standardize that as that could happen to you, so beware. And that's not necessarily true, right? Kendra, you're in Ohio and awaiting the snow. I know. I wish we even had the snow. Typically we get a lot of snow, but thank you, Jelly Jane. Thank you for the rose. But the cold weather has been so bitter, like so cold. Oh, you're right in the middle of a winter storm. I know, everyone's getting hit in just different ways, Becky. Why do some people have flappy skin after this treatment? Comfort. Okay, so that is something that happens, right? I already have some. So when we lose, so let me just say this, first of all, this medication has no way of knowing, well, I'm just gonna have you lose the FAT and not the muscle. It kind of does that simultaneously, unfortunately. But the things that we can do, though, to sort of have it be the FAT be the primary, is that we have to make sure we're getting enough protein, which is something we talk about a lot. We also want to make sure we're doing some sort of strength training to help with not losing muscle mass. So that is why eventually when people lose a lot of FAT and maybe a little muscle, there's a lot of flappiness. I already have that, even though I'm not a goal. So it's almost, I will take that over my chronically obese state, right? Because I know that I can do some exercises to help. But even with doing that, you still end up with flappiness. So, a lot of times people end up having surgery to remove that. But I would, again, if I were to do it over again, I would do the same thing. Can I ask where the best place to do the jab is? So Ash, everyone's a little different. Everyone is a little different. So the most common spot for most people to do their jab is typically in their abdomen, right? So it is like that. Can you see that? So I draw this circle in the middle because it's important that we're staying 2 inches away from our belly button. I'm not a very good artist, but it's important that we stay 2 inches away from our belly button. So if you imagine your abdomen stay 2 inches away, and you can do your jab here, like rotating out every week until you cover the 4 quadrants, right? The other spot that you can also give your jab, there is really no best place. I think eventually people figure out what the best site is for them. But even at that, we'll always say it's best to rotate site. And then the other place is the back of the arm. So the back of your arm right here. And then the front of the thighs, which is, in order of priority for me, the back of my arm used to be my favorite spot. Then it became my belly. And so I just rotate in between. So I go around the quadrants and I go the back of the arms. Then I do the front of the thighs, but it's not my favorite spot. So what you're going to need to do to figure out the best spot for you is to basically document your response every week after you've given your jab, whether it's, your side effects, the number of potatoes lost, until you figure out the sweet spot. So you're going to have to experiment to figure that out. Does that help answer your question? So thank you guys for the follow and the likes and all the things. Appreciate it. I'm gonna start drinking water now. What other questions can I answer? Oh, we've only been on for an hour, 4 minutes, 2.6K. Perfect. All right. What other questions do you guys have? Keep your questions coming. How is everyone doing? How are you guys doing on your journey? Are you experiencing any challenges at all? Let me know in the chat. I really would love to answer those questions for you. What about lightheadedness? So, Ginny, I would say if you're getting lightheaded, my first question is how is your water intake? Do you drink enough water, you think? So let me know, because if you're saying yes, you do, then I just say, you know what, it's just probably best that you go talk to your doctor, because dehydration can present itself as lightheadedness. So when you're just not, when your volume of fluid is not sufficient for your body, especially if you're getting diuresed by the meds, then you need to replenish that. And if that's the case, then that's what you need to do, is drink more water. But if you're saying I drink enough water and I still get lightheaded, I would just go see a doctor, because sometimes it could be other things that's causing the lightheadedness, and you want to make sure that someone's assessing you to make sure it's nothing else, right? Than the medication. When did you start noticing the WL? You know, I was, so get this, I probably was like 20 plus potatoes in when somebody actually said, it kind of looks like you're losing weight. So, but in terms of when you notice the scale moving, it's, they say about 4 to 6 weeks. For me, it was 4. So the first 4 weeks, I lost nothing. But I had less pain though, so my inflammation was certainly better. But there was no weight loss at all until the 4th week in. Hydration and electrolytes, yeah, that's important. Hydration is really important. Ginny, does that make sense? Yeah. So if you're just starting on the journey, don't expect that you are going to lose. Bridget, thank you so much for that heart me. I appreciate it. Don't expect that you're going to drop very quickly. It takes a little while. But that does not mean that the medication isn't working, though. I want you to be rest assured it is. It's working from the inside out. Always is. That's a very good question, though. But yeah, just see how you feel. Make sure you're hydrated. And if not, then, you know, see a doctor. Make sure, because correlation is not always causation, right? You want to make sure they're ruling it out, you know, other things out too. So how are you guys doing? That's a very good question. Are you guys doing well in your journey? Are you getting the results that you had hoped for? All the things. What do you have? What non-scale victories do you have to share? Let's talk about them. Welcome in. Welcome in. I see that the chat is fluctuating. My name's Colette. If you're new, I am on my GLP-1 journey. I started my journey 20 months ago. Because I was just in a very bad place in terms of my health. I was not only in a chronically obese state, because I was, but I was extremely inflamed and in a lot of pain. And, you know, just dealing with severe osteoarthritis, taking tons of meds. And I needed something different. And I went to my doctor and said, I need help. And I don't want to hear walk more, or rather eat less and move more, because I can barely. Thank you, Angela, for that heart me. And I said, I can barely move, so I need help. Anyway, so had some discussions, and fast forward a few months after. What I do love about it is what the approach to my program through my insurance was very holistic, you know, because they asked me a lot of things about my stress, you know, and all the things. And, you know, how often do you exercise? How do you eat? So they kind of looked into all of those things, and gave me the support that I needed. But then I got a prescription for topiramate, took that for about a week. I hated it, stopped, and then went back to my MP and said, you know, this is not working. Can we maybe have a discussion and other options? And at that time, I already dabbled into TikTok. I was here, and I was hearing from other creators and other people like you guys sharing about your journey and the effects of this wonderful medication. And so I basically was asking, can I get on a GLP-1. So then I got started on Zepbound, and pretty much the rest is history, because that's what started my journey. So I do like to come on to share my story and to encourage you guys that, you know, weight loss in this program and this journey is quite possible, you know, and the things that we should do to get there. And I also share my you know, my struggles as well. I know that I had shared earlier in this live how, you know, being off of the meds for 2 months because I had to have knee surgery was a huge challenge. I gained 10 potatoes in the process. I have lost it since, but that just went to show me that, you know, this medication is doing a lot more than just weight loss for you. It's helping control your relationship, that terrible relationship that you've always had with food, and helping you stay, you know, just stay healthy. And so you know, I'm going to always be on this medication for as long as I can have it. Yes, I'm team forever. I know I get asked that quite a bit just because of the other benefits of these meds. So that's who I am, and that's why I share, because you know, I feel like if I can talk about. No, Vicky, there wasn't, because I've never been one that has lost a ton. I've always been a very slow responder to these meds, and I'm very grateful for it. So that has not been a problem that I've encountered with hair loss. So anyway, so yeah, so I do like to come on to share my story and to encourage people, because if I can help one person not end up in the emergency department because they're, you know, not like listening to their body, watching to see how often they're moving their bowels and so forth, you know, that is to me a huge accomplishment. That's what I want to do. So your insurance pays for your meds? They don't right now. They did until, and I think that happened to Jenny for a lot of people that lost coverage. Like mine was January of 2025, where, you know, I had other options. My insurance offered me other things, like, you know, bariatric surgery was one of them, and some other types of meds that were not GLP-1. So it's not like they said to me, we're not going to cover this, so you're on your own. They said, you know, the formulary will no longer have GLP-1s as one of them, but here are the other meds that you can get on. And none of those were appealing to me, frankly. And that's why I decided to go with a telehealth company like Join Fridays, where I now get my meds. So that is my story. Welcome in, guys. Welcome in. Thank you so much. Keep tapping on the screen. Let's see if we can get to 20K. Can we get to 20K? Get more people in here so we could chat. Get more people in here so they can ask their questions, because that's important, right? There is no question that is too lame to ask. I always want to make sure I hold a very safe space for everyone to come in and ask their questions and not feel, you know, judged by any means. So make sure you are asking your questions, and thank you guys for hanging out with me. I really do appreciate it so much. Kendra, thank you for your participation in the chat and for answering questions. I appreciate you. And for everyone who's responding to other people's questions, thank you. J Lux, all of you. I appreciate all of you. But let me know what questions you have. Okay. And if you want to come up and, oh boy, hang on, guys. Sometimes I go click happy and I start clicking on things that I'm not supposed to. Now I don't know how to get out of there. Oh my gosh. I'm still here. I'm just trying to close the screen out. And just... Okay. You guys are seeing me, but I can't see you because the screen here is... What did I do? I'm not seeing the questions, guys. Okay. Okay, so let me know if you would like to come up. You can request. I have that little sign, the plus sign to come up. So if that's something you want to do, let me know. I'm happy to bring you up and we can have a little conversation if you want to. Thank you guys for being here. Hey, Colleen, how are you? How are you, friend? Happy Saturday to you. How are you doing? And you're in Jersey. What's your temperature like over there? Right? You're in New Jersey, I believe. It's good to see you. How are you? It is cold here in the Midwest. It's crazy cold. And we're probably gonna, and not probably, we do have a best. You're in Rhode Island. Yeah, I don't know why I can't think of that. Yeah, it is Rhode Island. What's the weather like there? Probably cold, I'm sure. Well, we do have a basketball game today. My youngest is in a tournament. So in about an hour or so, we're gonna head out. It is so cold. It's just crazy cold. I mean, how many of you have, the whole cold, like getting very cold, like suddenly it's cold. We're getting 2 feet of snow. Everyone has some sort of snowstorm moving in or cold weather. It's crazy. I'm just over it. But we have the GLP-1 that makes us cold to start with, and then now we have cold weather on top of it. But I was just gonna say I was one that was always sleep with a fan on, and now not at all. Like my husband's like, "What happened to you?" I'm like, GLP-1 happened. That's what happened. My hands are always cold. Yesterday, after my son's game, we got in the car, and I was like, "Oh my goodness!" And I had gloves on, and they were pretty warm, but I felt like my fingers were like I couldn't even barely drive, like put my hands on the steering wheel. That was horrible. Sarah's asking Ters, okay, why am I always so tired and indifferent and not excited about anything? Oh no. Oh no. So, Sarah, I'm sorry that that's happening. I would I would really encourage you to talk to your provider about this because we have to remember that this medication crosses the blood-brain barrier, and obviously you have the receptor sites where it acts. This could either cause, I've heard people report a variety of things, either saying, you know what, I used to be very anxious and now I'm no longer very anxious and this medication has helped me, or they report, I'm all of a sudden getting very depressed and I'm not sure what's going on. I think in all cases, it's important to be talking to your provider because they need to have some oversight. And that, Dr. Michelle, thank you so much for the heart me. They need to know exactly what you're dealing with because it is that important. This medication can cause some of those types of side effects. So if you're feeling indifferent about things and not excited, that's concerning. So I think you should talk to your provider about it. Okay. Yeah. Yeah. So Kendra, the tiredness is great. I mean, that eating makes sense, right? So let's think about it for a second. So eating makes sense if you're feeling fatigued or just your body getting used to the meds. However, I think when I think more about the indifference and no excitement about things in life, I think that that is a bigger concern in terms of mental health. So I always say, and I do agree with you, but I do think we know that these meds do cross the blood-brain barrier. We know that. That's why it helps with sort of that emotional eating and the reward centers and all of that, right? So if it's having that type of effect on anybody, right? It's important. I think there's value in having discussions with your provider about this is what's going on, and it's been happening since I started this medication. Thank you so much for the populace, Dr. Michelle. What can I do about this, right? I think there's a lot of value to that. All is well. Thank you. We're trying, Dr. Michelle. All is well. Yes, all is well. I know where you're going with that. All is well. We're doing the best we can. Thank you so much. I do appreciate you. Thank you for coming in and supporting me all the time. I appreciate it. The problem is when I'm listening to you live, I'm driving home from work, and then of course I have to do it cautiously because I get to a stop sign. I go, okay, I can tap a little bit. I can do this and I can do that. But thank you so much. You're so supportive. I appreciate you. Yeah, does that make sense, Kendra? That's what I'm thinking. But no, I agree. The fatigue, for sure. Not eating enough can be part of the problem when people report that, or not drinking enough water, frankly. But those other things are sort of a little bit of a bigger concern for me. And guys, Dr. Michelle is a relationship doctor. She talks a lot about relationships, so please follow her if you're not already doing so. She's amazing to listen to. She's a relationship expert is what I meant to say, really. She's amazing. Let's see if I can get her up here on the pin. Why doesn't it let me pin you? Interesting. Why? Did I lose my ability to pin? Is this happening again? Seriously? You're welcome, Sarah. Interesting. It doesn't let me pin. Why? Oh, maybe because, okay, so let me do this. Maybe because I don't know. Let's do this. No, not that. Guys, I'm so sorry. I'm trying to, not that. It doesn't let me pin. I think I may have to change this to a full screen and then it might let me pin. Let's try this again. That's what it is. So when you have the request up option, it doesn't let you pin comments. So now I can pin Dr. Michelle. Oh my gosh. Just when I think I figure this out, I don't. So there's Dr. Michelle. I had to change the presentation of my screen for that to happen. So thank you guys for being here as I'm sort of trying to figure this out, but I think I got it. So if you're just coming in here, my name's Colette. Let me know if you have any questions. We are talking all about GLP-1, answering questions, talking about all the things, and connecting and everything else. So you let me know what questions you have, and I can answer them for you. Okay. Thank you guys for hanging out. I so appreciate you guys. Thank you, Dr. Michelle. Thank you so much. I appreciate you. Okay, let's see. Mari is asking something about dopamine. Let's see. I can't quite see that. Give me a second. Thank you for the follow. Thank you, Dr. Michelle. What about dopamine? Yes, I agree. Dopamine in the brain, right? Yep, absolutely. Yep, that's why I think it's important that when we get these feelings of either, a little more anxiety, a little more, or of the opposite, more, like feeling down and not just happy, it's important that we're talking about it with our provider. Yes. And that's exactly where I said the medication crosses the blood-brain barrier. So FM Gal, I want to get it. I'm in the Caribbean. Unfortunately, we don't ship to the Caribbean at this time. Yeah, I'm sorry. Celeste says 99 a month for the first month. Yes, the first month is 99. And obviously, that's because you're saving 150 using my code. If you were to get on a longer subscription, then you would save more as well. Not more than 99, but it would be pretty close to that if that's something you want to do. Thank you for the stickers. I love it. What's the next month? I need it long term. So Celeste, what I would advise you to do is if you need it for long term for the SEMA is to sign up for the 12-month subscription, because that you will get, I have to remember, I don't remember exactly what it is, but you're going to pay that ahead of time. So then you'll be able to lock in a lower cost if you were to do that, for sure. Because that would be the best, especially when you want it when you need it in the long term, right? So because if you were to do month to month, all you have to do is at the 150, and so it'd be 249. That wouldn't be worth it for you if you're looking to save money in the long run. I would do more of a 3 or a 6 months. That way you could get it lowered. Does that make sense? Linda Shaw says, I'm on 0.25 OZ. I'm supposed to start 0.5 next week. No hunger, but feeling very lazy. Huh. Yeah, eating is important. That's probably why you're lazy, because you don't have any energy, Lindish. That's probably it. So, yeah, I don't know that going up in a dose is the right thing, especially if you have no hunger cues. Guys, we have to be able to eat on this journey. Otherwise, it doesn't work to our advantage, with regards to losing weight and then feeling, energized. It's not going to help, because if you don't eat, if I don't eat, I'm equally lazy. I can't do much. So, I think it's important that you stay on the dose if you can, talk to your doctor and say, you know what, I'm not eating a lot on this journey and I'm only in 0.25. Do you think it's worth going up on the dose? Because chances are it's probably not, right? You're probably going to get more suppression and not eating. Canoli says, what if we had a bad reaction? What do we do? And I had weight loss surgery about 12 years ago. What bad reaction did you have? Tell me a little more. Hi, Combat Barbie. Thank you for stopping in. Where to order? So I think you're in the Caribbean, right? We don't ship to the Caribbean. Yeah. Unfortunately, at this time we don't. I mean, that might change, right? So tell me a little bit more about the reaction that you had just stated that you had, Canoli, and having weight loss surgery, does not exclude you from being on the GLP-1. As a matter of fact, I know a lot of people that have had weight loss surgery that have gotten on a GLP-1, maybe because they regained or for whatever reason, and they're able to, keep the weight off. So I don't think that's an exclusion criteria, but I'm interested to hear about the bad reaction that you're referencing. All right, let's keep asking those questions, guys. Thank you so much. We're almost close to 20K. Thank you to those that have shared out the live, that are tapping on the screen, asking the questions, reposting, all the things. I do really appreciate it. It does help the live get pushed out, and it also helps TikTok recognize you as an engager as well. Dr. Michelle, thank you for the stickers. I appreciate it. Thank you, Kelly. Thank you all for being here. I really do appreciate it. 20K, let's go, Dr. Michelle says. Hi, FM Gal. What other questions do you have? I know you said you are in the Caribbean, and we do not ship to the Caribbean, unfortunately. Thank you for the rose, Kelly. I appreciate it. Yes, unfortunately, we don't ship outside of the US. So Yeah, I'm sorry. I wish I could help, but so how are you guys doing? How is everything? How was your weekend? What are your plans this weekend? You guys doing anything fun that you want to share about? Anything at all? Doesn't have to be GLP-1. I'd love to hear it. It can't be shipped, no. How much is TERS? So according to what I have up there, TERS is 209 to start. If you are taking a break from work, thank you for joining. If you are to start, or rather, if you were to do a month to month, right? So assuming you started and you thought, I'm just going to get the first month, and then if I need to get another dose or another dose next month, I will. You will start with 209, and that includes shipping, includes your one-to-one visit with a provider, also a one-to-one visit with a dietitian, which I do recommend highly, and group coaching for nutrition, movement, mindset, all the things, all of the perks that they have. That's all included. That's all you pay, 209. And let's say next month you thought, you know what, I think this is working, so I'm gonna get another 4-week supply. That would cost you 359. Now, if you were to say, you know what, I want this for the long run, so I want to maybe be able to do like a 3 or a 6 month or a 12 month, that's going to get you down to a cost that I can't tell you right now because I don't have it in front of me, but that's certainly going to be lower than the 359. Does that make sense? And the longer your subscription, the less, or the lower the cost. Just trying to stay warm. It's so cold. Yes, Dr. Michelle. Dr. Michelle, where are you? I think I may have asked you that before. Will it still be effective for weight loss if I stay on 0.25 since I'm not hungry? Absolutely. The key thing is you want to be able to eat, right? But of course you want to be able to eat the right things at the right amount, for sure. Let's be very clear on that. So if you don't know what that is, I would really say to you, since you're getting brand name medication, you should have access to a dietitian. You should make an appointment and meet with a dietitian to kind of give you some guidance on how to eat. Movement is important. So moving your body, sleep is equally as important. Managing your stress, all those things help. So the medication is one little tool in that toolkit. You got to do all the other things. So that's what I would say. But eating is important. And then drinking water as well. So these things do matter. Which of them do you recommend to combat, Barbie? I'm actually in TERS, but if, whatever you have access to or you can't afford, SEMA is also a good option. So if that's something that you're thinking about, if cost is the issue, I would go with SEMA as well. I will say this because that's just the general rule, is more report less GI side effects on TERS than they do on SEMA. And the general rule is if you want to lose more potatoes, TERS is typically the one to go with because it's an agonist, so 2 the receptor sites is 1 with a GLP-1, so the SEMA acting on those receptor sites. So you kind of get a little more bang for your buck that way, but that doesn't mean that it doesn't work to help with the weight loss, but that's just generally speaking, based on the studies that were done with the brand name, Zepbound versus, say, Ozempic. Most people lost 15% of their body weight on Ozy, and then up to 21 on TERS. So that's the conclusion. That was where that conclusion was made. But again, we all respond differently to these meds. So Dr. Michelle, you're in Chicago, and it's 64 degrees in Phoenix, Arizona. Jay Lux, yeah. So that's better than negative 10, 20 that we have here in Minnesota. So Chicago, pretty similar to the type of weather we have here in Minnesota. So I get it. But maybe not as cold though it's windy in Chicago. It can be. Celeste, what do you mean what? So TERS is what I'm going with. Thank you. You're welcome. Absolutely. Let me know. Let me know if you need help going to order or anything like that. All you need to do is go to Join Fridays, DOT.com, and then follow the rest of the instructions that I have on the top left corner. That should get you there. So yes, it is, Dr. Michelle. Pretty similar. Yeah. And pretty windy. Yes, I remember. Yeah. OZ is supposed to release in a pill form soon, but it's supposed to be less effective. I don't know that to be. Is that what you're hearing? I know that Wegovy is out. That's the pill form, right? Same category, semaglutide. Thank you so much for the hand heart. I appreciate it. But I don't know in terms of the efficacy of the Wegovy pill versus the injection. I think it's pretty close, is what I hear. But there's some, well, not stipulations, but there are ways that you have to take the oral ones. You have to really follow the orders and do it the right way to be able to combat. Barbie, thank you. About relying upon sparkling water. What about it? Dr. Michelle, something about sparkling water? Is that what you like, your preference in drinking water, sparkling water? What are some of the benefits? I've never really been one. I mean, occasionally I will drink sparkling water, but I don't do it as often. You had a comment before that. I didn't see it. TikTok is just being weird today. Sorry. That's why I felt fragmented to me. I didn't quite get it. But you're probably talking about sparkling water and the benefits of sparkling water, maybe? Do you have any dietary recommendations when an OZ am trying to take as much protein as possible? So, yeah, protein is certainly something you need to prioritize for sure. So you're right about that. But it's also important to also have some carbs, right? So complex carbs is probably best so that your sugar doesn't spike, go up and down, that it's more sustained. I would personally, and you should have access to a dietitian if you're getting these meds through your primary care doctor or anywhere else, actually through your insurance, right? That should be like an added coverage. And I don't expect that they would. I think it's more of a compliment because I think it's going to help, especially if you are a diabetic or trying to lose weight on these meds. Just having that time with a dietitian to sort of help you understand how to eat is going to be very beneficial. But if you don't have that access, I would start with a TDE calculator to figure out what your caloric deficit is, and then your different, macronutrients, your protein, carbs, and FAT, because those are important. And I would certainly add like 25 to 35 grams of fiber every day to all of that to help you. Yeah, but reach out. They should have that support for you, I would think. Tracy, hello, welcome in. Welcome in. Yeah, I think one thing I have learned is it takes, dietitians are very well educated, and a lot of them have a lot of knowledge related to, like how and what to eat on a GLP-1, and they can certainly help guide you. Like when I met with a dietitian and joined Fridays, I thought I was supposed to be eating a certain number of, like a certain number of grams of protein. And I was surprised that I wasn't actually getting enough. And then of course, helping me understand, my alternatives with protein if I wasn't, because not everybody wants to eat meat or fish. Some people are just vegetarians and there are options. Okay. Acid reflux. Oh, and sparkling water. Does it make it worse? Dr. Michelle, hey Keisha, thoughts and tours while having gastritis, GERD, and hemorrhoids. I would hold off and talk to the doctor about that even before starting, is my advice. Yes, it does. I agree. Because obviously it bubbles up, right? Yeah, not a good thing. And Dr. Michelle, I had a bad case of GERD prior to, like before even starting this journey. And I'm so happy I don't have to deal with it anymore, but it was miserable to the point where I had to take meds for it. How to prevent gastroparesis. So Anna, the only group of people that I think are at a higher risk for developing gastroparesis are diabetics. And the medication itself will not, there is a chance, but it's a very tiny little chance that you will have gastroparesis. I think people get it misunderstood in terms of gastric delay and gastroparesis. Gastroparesis is total paralysis of your gastric system where nothing moves, right? So if you have that as a presenting problem, I don't think you should be on these meds, because what these meds do is they sort of, it delays gastric emptying. So food would just be in your stomach for a longer period of time. And if you're already dealing with paralysis of your gastric system, I don't think you would be a good candidate. It's just going to compound the problem, if that makes sense. But, so I can't really tell you that there is one thing you ought to do. A lot of people that are on these meds understand that part of the mechanism of action is that it slows down your gastric emptying so that you stay full for a longer period of time, which is why a lot of people end up with like constipation and all the things, right? Or diarrhea. Nonetheless, that's why we talk about probiotics to kind of help that gut health, right? But it's just one of the ways the meds work. Yeah, 20K. Thank you. Thank you, Dr. Michelle. Glad that issue has resolved for me. It really has. And I think part of it, and I tell people this when they come in and they have concerns about GERD, is sometimes when we are larger, especially in our abdomen area, right in our abdominal section, that FATT pushes on our little stomach, right, which causes that GERD to be worse and cause that, sort of that reflux problem. And then once we start losing, which I have lost quite a bit, my gut used to be pretty big, it kind of helps with all of that, because then you're not having, it's just that pressure kind of gets released, and then you're able to process things better. But even with the nature of what this med does to our gut in terms of that delay of gastric emptying, it kind of puts people at risk for that GERD. So we have to also be mindful of that, because food will sit in your stomach longer, which might cause some of that GERD effect, which is why we talk about walking after every meal, sitting up and not going to bed right away, because those things help prevent that. And GERD is not a good thing to play around with. It could cause like esophageal erosion over time, because it's just acidity that comes right back up, which could create more problems in the long run. Sunshine, I don't think I understand your question. Do you want to re-ask your question? I have mild diverticulitis, and I've been treating with probiotics and supplements. So far, no issues. Good for you, Lindish. Pound Cake, hello, welcome in. Can you take the Bi-Fi what is that? Bi-Fi Vital Source Vitamin Y on GLP-1? I don't know what that is. Or is that a typo? I am not sure that I understand what that is. Bi-Fi Vital Source Vitamin? I don't know what that is, seriously. Tracy is saying, I'm not losing, not hungry. Well, that's probably why. If you're not eating, your body is going to try to hold back, everything that it has, including not letting you release any pounds, because it thinks you're just not going to nourish it the way it wants to. It's just a very common response. It's not uncommon at all. So eating is important so that you lose, but you want to eat the right things. Is TERS compound with B12 less effective? Not necessarily. So with compounding medications like TERS or SEMA, your doctor is always going to compound the medication with, whatever they think that you need. A lot of times, I remember once upon a time for maybe about a month where it took mine with B12. I was still getting response. It wasn't anything that was, I did not feel it was less effective. So, but it has to be personalized. It has to be something that you actually need, right? Because B12, a higher level or too high of a level of B12 can be actually detrimental. It's not a good thing for you, right? So it has to be something that you need. Say if you're always tired and your levels are lower, obviously it's beneficial when you have B12. Is it normal to lose 19 in 4 months? So that's, what is that? A little less than, I gotta do math, you guys. Can't do it right. I always think I can, but I can't. So 4 months, 19. So so that's 4.75 divided by 4. So yeah, a little bit over a pound a week. That's perfect. Absolutely. It's very normal. Very normal. That's perfect. Yeah. I want comfort. You want what? Do doctors usually follow up with any blood work while on OZ? Should I ask? You should. So Linda, tell me, Lindisha, tell me this. Are you taking OZ because you're diabetic, or are you taking it for weight loss? Because typically in the United States, it's prescribed for diabetes management. So tell me. But I do believe, regardless, that it's important to get baseline lab work on these meds and periodic monitoring of lab work as well. So lipo-C is, I kind of refer to it as an FAT dissolver, especially in our abdominal area. So it's a type of, it's really a supplement. It's usually, it has methionine, inositol, and choline, right? Those things are sort of help with dissolving FAT around your abdomen. So that's what it is. I weigh 120 and I'm what? I don't know. I think a lot of times you just need to take the quiz. You don't have anything to lose, and then it tells you if you're a candidate or not, especially with Joint Fridays. That's how but 120 seems pretty low to me, but I don't know what your height is. So it depends on what it sort of reflects in terms of your BMI, right? That's usually the qualifier. These are all good questions. So comfort, all I have is I weight 120 nm weight. That's all I have there. So I don't know, maybe you missed out on a few things, or a few words is what I mean. What other questions do you guys have? I think I'm going to go for another 15 minutes and I'm going to close out the live. So we'll be on for a total of 2 hours. So please ask questions now if you have them. And thank you so much for joining the live and participating in all things. I appreciate it. Or let's see, maybe we can move it to this tripod and go sit somewhere else. That could be another. I switched from Sema 2.5. So T 5.3 comfort doesn't still make sense to me. I switched from Sema 2.4 to TERS and I'm not feeling the suppression. Okay, so you went from Sema to TERS. I'm on week 2. Is that normal? Yeah, it probably is just going to take a little more for you to start feeling the suppression. But remember, suppression is not what we're chasing. It's that satiety, that ability to feel full and not want to always eat. You still want to eat. You don't want to be totally suppressed that you don't eat, right? So it probably is just going to take a little while, but as you titrate up, but make sure you are really getting in your protein, your fiber. Those things are going to help you feel full for a longer period of time. Oh, so yeah. So Lindisha, I think it's important to get baseline labs no matter what. Yeah. So baseline labs are important. Yes. You're taking it for PCOS and prediabetes. Makes sense. So I'm a firm believer, and that's why I think it's important to have the supervision of a provider while we're in these meds and not just do it on our own, right? Very important. BMI over 40. That makes total sense. Yeah. Let's see. What if you want to lose weight from your tummy? Well, I don't think you get to choose where the weight comes off. Suspect 774. It just happens wherever it needs to happen. Now, if you're concerned about your tummy, I would probably add things like we just talked about, like the lipo-C, right? To help once you've started your GLP-1 regimen, you can add that to help enhance your metabolism. One second, guys. I'll be. Go ahead. You can have it. Okay, guys, I'm back. I'm back. Sorry, I had to pause for a minute. All right, just had to change positions here. Okay. All right, who else is here? Okay, let's see. So suspect 774, like I was saying, I don't think we have control of where the weight comes off, but like I said, you could use, something like Lipo-C to help with your metabolism if that's something you choose to do, for sure. But we have no control, right? Deanna, thank you for the heart me. I appreciate it. Oh, you're 5'6", 258, and want to lose 30. You can, absolutely. It's possible. This medication does a whole lot for a lot of people. So you got it. You can. You just have to stay consistent with, again, moving your body is essential. I think we talk about that a lot. It's important that we're moving our body 30 minutes every day. So whatever that looks like for you, whatever gets your heart rate up. Drinking enough water, all those things help. What dose am I on, Natalie? I'm on 11.125. That's what I'm on. Yeah. And Tracy, you can't lose. Why? What's going on? What is going on? Let's talk about it. I have a lot of time. I just had to change locations here. You're never hungry. Okay, what dose are you on, Tracy? J. Rude, how are you? Welcome in. What dose are you on, Tracy? So one thing I always say is if you are in you're in 12.5, okay, so maybe, because maybe part of the reason why you're not losing, honestly, is because you're not eating enough. Your body needs food in order to function. So if you are not consuming enough, you're not going to release the weight. So it is important that you are, eating enough. So 12.5 might be too high of a dose, maybe, right? So maybe thinking about going down on your dose might be a suggestion. You do need to eat. I mean, granted, the medication does have appetite suppression. We know that, but it's now the ultimate goal. We just want to be able to feel full for a longer period of time. Yeah, Natalie, I would talk to your doctor. And just see, and you're not losing either, and because you're not eating as well, you're getting full suppression and not able to eat. Is that why? Amber says, how soon should you go up in a dose? I would not go up on a dose for at least 4 weeks. You want to make sure that the medication is, working in its full effect, right? You do want to stay on the same dose for at least 4 weeks. It's typical, right? And even at that, it's sort of debatable because if you are losing 1 to 2 every week, there is no reason to go up on your dose at all. There really isn't. Because going up in the dose, and I've had people come in and share this, it doesn't necessarily give you, it doesn't it doesn't necessarily mean that you're going to lose more weight, if that makes sense. What do I recommend? GLP-1 and TERS. So TERS is a type of GLP-1, Rosie. So we're talking about the same medication. Are you saying would I recommend Sema or TERS? Is that what you're asking? And to that, I would say it all depends on what you're looking for. If money were the issue and you wanted to get in and kind of try, okay, got it. So if cost is the issue and you want to be able to be a little more frugal, I would go with Sema, honestly, and try it. But if you're saying to me, I have a ton of weight to lose and I really want to get going, I would maybe try TERS. And Deanna, you just you watched my live for 500 minutes. Thank you so much. I'm getting a sensation of throat tightness. Amber, go to the emergency department. Okay, if you're getting a sensation that your throat is tight, I can tell you if it's related to the medication. As a matter of fact, there's nothing I can do, but I would just say get into the emergency department because tightness of the throat can lead to you not being able to breathe, which is not a good thing. So I would go in and get seen. I want something that is not going to have me feeling sick. I would go with TERS. That's what I've been on, and a lot of people, and this is not a judgment against Sema, but a lot of people report more GI side effects on Sema than they do on TERS. I have TERS at 10 and still need to lose 10 pounds, stuck in a rut for over a month now. Eve, let's talk about it. So are you getting enough food? Are you still eating enough, or what's going on there, or you're eating too much? That's the other question I would ask. So make sure you are doing a very thorough evaluation of what you're getting into your mouth, and track your calories. It's important to do that. Figure out, hopefully you're eating in a deficit, I would hope. Make sure you're getting your protein in, all the different food groups as you should, per the recommendation of the TDE calculator. And usually when our weight fluctuates too, we have to go back in there and recalculate. So make sure you're doing that. Tracking is going to be essential when you hit a stall. Switch up your injection sites. What else can I say? Drink enough water. Make sure you're continuing to move your body. That's essential as well. Yeah. And then see how you do. Okay, try those things. How are you all tracking calories? So Mika Rissom, I personally use the TDE calculator. Yes, you're welcome, Eve. Absolutely, because that's exactly what I do too when I hit a stall. Yeah. So I use the MyFitnessPal app. That's what I use, the MyFitnessPal. Let's see if I can put it in here if it lets me. 1 second, I'm going to put it right in here in the comments. MyFitnessPal. See if I can pin that. There it is. So that's what I use. Mika, that's how I track. And it's free. You don't need the paid version. What's your take on compound GLP-1? So locked 13. I don't mind being on a compound medication. I mean, I've been on a compound medication now for a year. Yeah, because I lost access to, not lost, I make it seem like I lost insurance. My insurance stopped prescribing my Zepi a year ago. So I've been on compound since, and I've been doing fine. You just have to make sure you know where your medication is coming from, like your telehealth company, and where they're getting the meds from. I'm with Join Fridays. I've got my information on the top left corner. And yeah. Tracy says, I love no food noises. I love that. That's amazing. It's one of the The best things about this medication, for sure, that does not mean we don't still eat the things that, because this is a lifelong journey, right? We're not going to just say, you know what, I'm not going to have that iced coffee. Somebody actually asked me this, and I almost wanted to respond with a video. And she said, because I went to, I think it was Caribou, Starbucks. I think it was Starbucks, and I got an iced coffee. So good. And she goes, well, I call that food noise. Well, it's not, because guess what? I didn't go back the next day. And even if I did, I just know how to drink or eat. It doesn't affect me. We still enjoy things, but we do it in moderation. So yeah, but the food noise is gone, right? That's the biggest part of being on this medication. It's just not that. It's the ability to have the, you know, not to have that, nagging thoughts about food all the time. Carla says, I was on the GLP-1, 2.5 and over a month and staying in the same two weights. Should I get, yeah, it's probably time for you to increase, but make sure you're dialing in nutrition though. You got to do all those things and move your body as well. Um, let's see. Oh, but you're not losing? Are you eating enough though? And it's not to say that we need to be too focused on the scale. I mean, we shouldn't, right? Because if you're measuring yourself, you're probably losing inches. But I would also wonder if you're eating enough. That is the other thing. Because when we're not eating enough, we're not going to lose. Our body is just going to think we're going to starve it, so it's not going to want to release anything. So that's a known fact. So make sure you're eating enough, Tracy. And it might help if you're tracking what you're eating based on your healthy caloric deficit. Does that make sense? Eating is important. We got to eat to lose. So thank you guys for being here. I think we can get to 25K if you guys want to keep tapping. That's great. I was so sick with cancer. I'm so sorry. That's probably why. Yeah. Well, allow your body to heal, Tracy. Give it some time to heal. I'm so sorry that you had to deal with that, but oh, well, you lost 40. Okay. Well, hey, you have permission to just let your body heal itself first. And you might want to maybe even put the GLP-1 on the back burner for now and take care of you. Okay. That's important. Oh, you gained the back. Okay. That's okay. And your body, again, is healing. You've had to deal with a big thing here. Cancer is not small, right? And congratulations for surviving it and going through it. And just let your body give yourself the permission to heal properly. Okay? Thank you for sharing that. Thank you guys for hanging out. I appreciate it. Scale, stalling, the clothes showing something different. I love it. Put on size 15 jeans and lose. Yeah. You know what? That is so good that you said that, because a lot of times the scale might not be telling us what we want to hear, but that does not mean this medication is not working. And my friend Shannon had told me that a while back. I did a short co-host live with her. It was impromptu. It wasn't even planned. And she, I was in a stall then, and I was sort of concerned. And she goes, "Have you measured yourself lately, Colette?" And I hadn't. And for sure, I was losing inches. Yeah, so Tracy is saying, thank you, Tracy. I'm going to share that if that's okay. I'm going to put it here on the pen. Thank you for sharing that. And we're glad you have come through it. And she's saying, you guys get your colon checked. So some awareness there for colon cancer. Thank you so much for sharing that. We appreciate you. Rose, yes. Did I miss something that you said now and I just don't see it? Let's see. Okay, you're just responding to Tracy. How can I get GLP-1 Owen? Very easy. All you need to go to is go to Join Friday's DOT.com and then follow all of that. instruction that I have on the top left, the first thing you want to do is take the quiz and then apply everything else or reach out for sure. We're probably losing inches. Yes, absolutely. Does menopause interfere with weight loss? Angela, yes, it does. So if you are perimenopausal, premenopausal, postmenopausal, fluctuation in hormones in women can lead to weight gain. We know that to be true. And sometimes when we correct that deficiency or fluctuation in hormones, we start seeing results. But certainly GLP-1s do help. Mm-hmm. How to get Jeannie, did I say that right? So you could do one or two things. Go up to, I've got all the instructions up there, but you're going to have to add DOT-COM, right? And then, you go through the process. It's going to have you take a quiz. And then, of course, enter my code at checkout to get your 150 off. So, and then reach out, okay? How to get rid of acid reflux while in a GLP-1. So let's talk about it. I think we talked about this earlier, but I realized we have, okay, got it. You're not looking for GLP-1, you're just looking to get information around acid reflux. So because food stays longer in our stomach, right, when we're on these meds, that's sort of one of the mechanisms of action is delayed gastric emptying. We can all agree with that. It may cause us to, say, let's say you eat, right? Say you eat at, say, 7 p.m. and you go to bed at 8. That food has not moved a lot because this medication is causing that delay in gastric emptying. So it's important to eat a little earlier before going to bed to help avoid acid reflux. I would stay away from things that are spicy, greasy for me. It triggers that. Those things help. Make sure you're taking probiotics. That's going to help your overall gut health. Digestive enzymes if you need it. Those things help. But certainly eating and going to bed right away could be one of the offenders. And then all the other things that I said. So try to be up for at least 3 hours after you eat. Go for walks after you've eaten to kind of help start the digestive process. That helps. Being in the larger body, you may get a little more acid reflux symptoms, right? Because that little stomach is tucked away, behind all of the FATTY might be pushed. So that again might put pressure, which then causes that reflux. But if you're doing all these things and nothing is working or helping, then talk to your doctor for sure, because they can prescribe yet another medication to help with that. So, because over time, if we keep getting reflux, it can kind of erode our esophagus, and you don't want that either. What about the patch? The patch does not work the same as our GLP-1s, okay? They're more homeopathic in nature. Angela says, I'm 61 and TERS for 5 months. How's that treating you? How are you feeling, Angela? Precious, thank you guys for being here. Make sure you're following if you're not already doing so, okay? And tapping and doing all the things. Precious, I lost 110 on OZ. Now you're in Manjaro 7.5 and a stall. Oh, wow. Well, that's a lot. Why did you switch? That's the question. It could be insurance. But like I always say, if you are finding that you're stalling, and stalling is no potatoes lost in 4 to 6 weeks. Let's be very clear and let's make sure we are grounded in that part. Because, weight loss is not linear. We're going to have ups and downs, and that's okay. Make sure that you're getting all the food that you need to get and you're not overeating. Make sure you're moving your body, drinking water, adding fiber, making sure you're having bowel movement every day. Those things help. Change your jab sites, track what you're eating, and hopefully start moving the needle. So, Cat on the Coast. Why isn't anyone telling us after a while these medications really don't work for long term? I don't know that they don't work for long term. They've been around for over 20 years. If you normally take GLP-1 in the morning but forgot and take it in the evening, that's okay. That's okay. Yeah, it is. Just try to stay on the same schedule, Carla. What is the difference between SEMA and TERS? Dama, you asked a good question. So SEMA is a single agonist, so one hormone acting on the receptor sites. TERS is a dual agonist, so it's two acting on those same receptor sites. One is going to help with that gastric delay. The other one is going to help with the gastric delay, insulin secretion, or good quality insulin secretion, as well as helping with the satiety, so helping your brain recognize when you're full. I took Wegovy, but my stomach issues made it not work at all. Is a pill any different? I don't know so much about the pill. It's it was just newly approved for use, right? I've heard people say in my life that they just started, so I think we need to give it a little more time. I heard a content creator talk about the efficacy, and I do believe it's pretty close, but again, we have to give it some time. So with Wegovy, you had stomach issues. Yeah. So in all of these meds, Wegovy, TERS, Sema, all of the things, you want to make sure that you're taking probiotics to help with your gut. That's important. Okay. Those things help. Dealing with mental, yes, I know. I hear you. I can help you with that because I too was, I'm postmenopausal and I'm really, really happy that I'm on the GLP-1, or I would certainly still be a lot, like in a larger body, because I know that that was actually influencing my inability to lose potatoes. It's just not the same like when we're in our 20s and 30s and we could lose very quickly. Not when you hit that menopause phase. So, no, not insurance. I started having sugar cravings and what's changed? Got it. Okay. Yeah. I actually take it. Let's see, 1 second. I take it for type 2, but the weight loss journey as well. Got it. So you have two reasons why you take it. Yeah. So back to your former question, though, now that I know why, again, I think I already talked about the things that you should do. Make sure you are really monitoring how your journey is going in terms of eating, exercising, sleeping, all the things. That's all important. Have you ever had a problem with your meds freezing during the cold weather delivery? No, I think Dave on the pen just had something about that in one of his. I just listened to one of his videos and he was talking about that. It's really not ideal to have it frozen, right? We don't want to. I hope that that didn't happen to you, but yeah, it's freezing cold right now. Everything just, I got water in my car I could use that is like stone frozen, like no water. So yeah, the weather is really, pretty cold right now, and we should be very mindful when we have these deliveries. We need to be able to have somebody either will get it or get it into the house somehow. It's best to be under a stipulated temperature range, and frozen is not one of them. So Kat, you've been on TERS for about 6 months, lost 15, been stalled for 2 months with bad cravings. Oh, I'm sorry. And so let's talk about your stall again. Accountability. There's just no way around this. We have to make sure we are eating in a caloric deficit. That's important. I understand the cravings, and sometimes that no matter the amount of TERS or seminar that we're on, it doesn't actually turn that off. Do know that you have options. You can talk to your providers about, you know, um, about options in terms of other medications that are non-GLP ones that can help you with cravings, because they do exist. Okay. So make sure you're talking to your doctor, but nonetheless, make sure you are being accountable, watching what you eat, drinking water, moving your body, all those things. Those things are important to helping you lose weight, especially when you have been able to do it. I mean, you lost 15 in 6 months. That's amazing. But your stall could be just part of your ins and your outs. We have to be in a deficit on these meds. And I just shared the app that I use, the MyFitnessPal app. Use that to keep yourself accountable, because that's just as important. And drinking water, sleep, all those things do matter. Yeah, you're welcome. Absolutely. Absolutely. You need help? Huh? Okay. Um, my food doesn't process. I have gastroparesis when I was taking Wegovy. Oh, well, that's too bad, Audrey. Yeah, gastroparesis is certainly, yeah, not good. So, did you develop gastroparesis before starting your journey, or? Certainly, I would agree that, having gastroparesis is certainly, I think, an exclusion in starting these meds for what we know they do and how we know they work, right? So that would make sense to me. I'm sorry that that happened to you, but are you still on the medication or are you not? Let me know in the comment. Okay. I just want to know, like, if someone's can I take GLP-1 if I had my gallbladder removed? Kinusha, yes. A lot of people here on this platform have no gallbladder and are on a GLP-1. I've had it since I was 14 and okay. Wow. And so Audrey, so why did the doctor choose to start you on a GLP-1 with your known gastroparesis? I'm just wondering. I thought that was an exclusion for starting a GLP-1. Just wanted to know if anyone here is interested in getting started on the journey, on the GLP-1 journey. Just put a one in the chat. I'd love to connect with you if you're looking for a telehealth. I'm with Join Fridays. I'm an affiliate and I can help you with that. So put a one, okay? And I will just connect with you and give you that information. But one thing I will let you know is to make sure you're not in private and that you have followed me, because otherwise I'm unable to provide you with the information that you need to get started. But if you are interested in getting started on this journey, please put a one in the chat. Okay. And I will connect with you right after the slide. Thank you guys for the follow. So I'm just going to start rounding up. I may go live again. We just have to get ready here to go. My youngest has a tournament, so we're going to be leaving the house here shortly, but I would love to answer any last minute questions. So I'm going to give it till about, for another 15 minutes. So we're going to start rounding up. Thank you guys for tapping. Let's tap out to 25K. Let's do it. I have a heart disease and I struggle to lose weight. Got it, Audrey. So what are they doing right now for you? Are they maybe using other meds to help you with the weight loss as opposed to GLP-1s? Because that might not be ideal for you given your gastroparesis, right? Yes, Carla, you're welcome. I appreciate you being here as well. Thank you. Yes, I would. I love being here. Like I think my last live was Wednesday, and I was like, oh my gosh, I haven't gotten live since like 3 days. That is too long for me. But thank you guys for being understanding. I do love to come live when I can. Of course, balancing things out as best as I can with family and so forth and work. So appreciate you guys. Well, you're on a cholesterol medication. I see. I see. Good. Well, hang in there, friend. Hang in there. Do your part. Do the best you can. That's all we can do, right? We just got to do our best. Whether you're on a GLP-1 medication or any kind of medication, you're trying to lose weight. You're just going to try to do the best you can. So, but I get it. So I'm going to give it a couple minutes. Just 15 minutes or so. We're just gonna round up and I can take more questions, guys. I can take more questions if people have it. You're welcome, Audrey. We got you. Thank you for the likes. Let's tap it out. Thank you for those who are tapping. And make sure you're claiming your heart me's, or rather, claiming your points for the heart me's that you sent and the gifts, okay? It's that orange button on the top, and all you need to do is click, and it's going to give you options to claim. So you do want to be viewed as a participant here in the TikTok street. So You do want to be viewed as a participant, which you are. You guys have been very engaging, so thank you for that. Heather, thank you for that heart me. I appreciate it. Oh, Angela, you watched my live for 300 minutes. Oh, wow. Thank you. That's amazing. Thank you so much. Let's see. What other questions can I answer, you guys? Thank you for your engagement and all the things. I appreciate it. Appreciate the gifts. Appreciate the conversation. We'll see. Who knows? I might go live again. Who knows, right? We'll see how. Yes, absolutely. Anytime. And you guys know this. I've always said this. If you need to get a hold of me and I'm not live, please send me a message. But of course, you have to make sure you're following me. But I'm here for you. I really am. I love this community and I want to be here to support you guys as much as you support me. Jill is asking what company online is most legit. So I personally, Jill, I stand by Join Fridays. I'm a very careful and very conservative person. So all that they have to offer is really appealing to me because they not only give you the medication, but they also give you the support that you need to stay successful. That's what really puts, makes them stand out. So, and their services for all that they provide is pretty darn reasonable. If you were to single that out, service by service, you'd be paying a whole lot. So I would recommend Join Fridays. And if you're looking to get started, use my code and save $150 your first month for sure. Thank you for the follow. So Join Fridays it is for me for online telehealth. And you can do your research too. You can go to Trustpilot.com and just, enter any of the telehealth companies that you're thinking about and read the reviews. Yeah. You can do your own research for sure. Thank you guys for the follow. So we have about 14 minutes, right? Top of the hour. So I'm going to take last minute questions. I'm going to have you guys claim your points and tap on the screen and do all the things. You are very welcome. Thank you for your time. And we know how busy it is here in the TikTok streets, but you guys chose to spend some time with me, so I appreciate that. So ask away, ask away. We have a few more minutes left. There. What is the highest dose of TERS? So with Join Fridays is 11.125 M. 11.125. I know some days I wish, oh my gosh, I would love to try the highest dose, right? I dream of trying the highest dose, but right now it is 11.125. That's a good question. Any other questions? We have a few minutes left. Thank you all for hanging out. Let's keep tapping. You guys don't get tired of tapping. Tap, tap, tap. Why is it the highest dose? That's where I am as well. So I do think here's the reason for that, Nina. I think it's because with the FDA rulings, right? They can't really make like medication. So meaning make it very identical to brand names. So that's why they're able to cap out at that dose. I know it's not the best, but that's the best they have right now to be able to afford people that option. PTS 76 says, I'm a slow responder, 15 milligrams, 15 months, and 15 pounds lost. Don't give up. Don't give up. So, what I would do as a slow responder, and this is just my opinion, because I'm actually in that category too, is just do everything you can to make sure you are sticking with all of the guidelines when you're on these medications, meaning that you are eating in a caloric deficit, that you know what that is, and that you are tracking it as much as you can. That's important. Make sure you are drinking enough water, you're moving your body. So all those things that we talk about, I would just dial in all of it, right? To make sure you're doing that. That there should be able to get you at least losing, even if it's not to the extent that you had hoped for, it is something, right? So, make sure you're prioritizing your sleep, you are managing your stress. That's what I would do. Because would I stop because I'm a slow responder in this journey? Absolutely not, because I'm not going to be in the sides if I did. So at least this medication has given me not just a weight loss too, is making me, I am more healthy because I am on this med. So that's the way I look at it. So just make sure you are showing up and doing your best, trusting the process and not giving up. So do the best you can. That's what I would say as a slow responder, as a fellow slow responder. Don't feel defeated. Don't. Are you tracking what you're eating, PTS 76? The other thing too that you might want to consider, you are in a very high dose. Maybe try resetting. Has your doctor talked to you about that? So just sort of coming off the medication for a few weeks or however long your doctor wants you to come off of it, and allowing the receptor sites to sort of rest from the GLP-1 flooding and then restarting. Have you tried that? Would 62 down in 18 months be considered slow? I don't think so. I think that's perfect, Nina. I think you're responding well. Because, and I don't have my calculator here to do the math, if you are at about 1 to 2 every week, that is like a normal responsiveness. Now, if you're about a 0.5 or less, I call that slow responding. So I think that's great. 18 months and 62. Because here's the thing with the studies with Zepbound, and I don't know the extent of time that clinical trial went for, but people lost, I think it was like 50 potatoes in a year. So I think 62 and 18 is phenomenal. I think that's great. So that is wonderful. Any other questions? Nina, thank you for the likes. Thank you guys for tapping. I think we are going to be at goal. I think we already are at 25, so we have 8 more minutes. So I'm just wanting to answer more questions if you guys have it, and make sure you're claiming all of your points. But thank you so much for joining me and all the engagement and conversation. It's been amazing. It really has. I appreciate it. So for those of you that want to connect to get started on your journey, I will reach out to you right after the live and provide you with all the information that you need. What else? That's about it. I don't think I have any other thinking, what am I forgetting? Any other thoughts? Any other questions? We've got 7 minutes. What one thing were you hoping to ask that you needed answers to? Ask away, because you got a few more minutes. Thank you for the likes, Nina. Thank you for tapping. I want to start with Ozempic. Did not yet. Okay, good. So Vivian, is your insurance able to cover it for you then? That's good. I mean, you certainly can start with, I always say, whatever insurance offers, as long as they can cover it, oh, they're not? Okay. So if you're thinking, so are you thinking of going with a similar medication but compound? Yeah. Because in that case, that would be SEMA. Is that what you're hoping for? If that's what you want, you can reach out to me because you could get started today as low as 99 with my code. It's usually 249, but you save 150. You were asking about side effects. Okay, so OZ, or as a matter of fact, any of the GLP-1s, the side effects that you're going to have with them, especially with SEMA, so the OZ, don't be scared. It's GI, right? So it's going to be your diarrhea, constipation, bloating, all those types of things. I always tell people, make sure you are taking a probiotic. Those things that's going to help you because it's going to help the bacteria in your stomach, like the good ones, is going to build it up. And that's what you need. That's once you do, you're not going to have those side effects. True. I mean, I can tell you that's for sure. So that's essential. The other side effects that you may, Nina saying I was scared as well. Now I regret not starting sooner. Oh, that's so sweet of you, because we need to encourage people, right? Because there's a lot of fear mongering here in the streets and everywhere. And it's not true. I mean, this medication has changed my life entirely. Like, thank you for saying that. But, get on a probiotic. That's especially when you're thinking more of the GLP-1 category. That's usually what people report. Make sure you're staying hydrated. Make sure you're staying hydrated. Okay, hydration is important. 1 second, I'm going to tell my daughter something. Hey, Alts, black uniform. Alts, black. You're going to wear black, and the arrival time is 5:15. I know. Okay. So, probiotics, important. Drinking water, highly important. Moving your body, these things are important. You may experience fatigue. It's just one of those things that we experience when we first start the medication. But what you can do is make sure you're eating enough, drinking enough water, and resting if you need it. A lot of times it's your body getting used to the medication, and it's going to be better. So, that's what I have to tell you. Headaches could be another one, but again, hydration helps. Yeah. Okay. So those are the side effects, the general side effects, I should say. And it's possible. It's not for everyone, but if you are able to do these things, you're going to be able to avoid a lot of those things. Okay. So making sure you're staying hydrated, getting on the probiotic. Probiotics are good for several reasons, right? It's going to help with that GI side effects that people typically report. And 2, it's going to help the medication work even better because when we ingest food, GLP-1s get released in our guts. So it's kind of a 2 for 1, right? So the fatigue lasts a little bit. Mine was about 3 weeks for me when I first started my journey. And then I just figured I needed to drink more water. I needed to take electrolytes too as supplements. Should I take it in the stomach or thigh? It doesn't matter where you start. Typically, Vivian, people are going to start in their stomach for sure, because it just means it's a lot more accessible that way. And you've got plenty of cush, if you know what I mean. There's a good amount of FAT, which is where we need to be injecting into. So that's one. Typically, you will have to rotate sites over time. You're not going to just stick to your tummy. You're going to have to go to your thighs, the back of your arms. So whatever you want, you can start there. But typically, a lot of people are going to start with their abdomen. That's very typical. Does that make sense? And then you rotate the sides. Thanks for the follow, Joanne. Okay, good. And you can always reach out too. You can always reach out and ask questions, okay? But, finding the good spot wherever you feel that is going to take just constant, experiments, right? Because you might do your abdomen, and I have people that actually start with their abdomen and I just love it. I don't want to go anywhere else. What you should, because over time you might start getting very hard areas in your tummy and you need to rotate it out. So it's important to go like tummy, back of the arm, front of the thighs, All of the approved sites is recommended. So if you are, so here's one thing I will recommend for sure is if you're one that works Monday through Friday, when you first start, you should take it on a weekend when you're home, yes. Because if you find yourself in that fatigue category, which is oftentimes the case, you're going to want to have enough time to rest. So yeah, if you work during the week and you're home on the weekend, then take it on the weekend. That's what I do. Today was jab day for me. Oh, you're new here. Oh, you're in Canada. I'm curious if you can recommend the best. Yes, so Joanne, what are you looking to do? Like, I feel like they're both okay. And in Canada, I'm not sure what you guys have access to, what is generally provided for you guys. Company to have an assessment in Zepbound. Um, so they're all good. Which one do you have access to? Yeah. What do you need? I'm listening. What do you need? 1 second, guys. Sorry, you guys. Okay, Joanne, let me answer your question. Sorry, I'm just trying to get our daughter ready here. So I want and need to lose weight. There are many companies available online. Unfortunately, we don't. There are, yeah, you're right. I'm not even sure which ones in the United States ship to Canada, but and we don't. I mean, Join Friday does not ship to Canada, unfortunately, at this time. So I can do a little more research and maybe get back to you, okay, Joanne, and see who would be recommended because I'm not sure. Is that okay? So I can check into that for you, okay, friend? Okay, you're welcome. Absolutely. I can do because you're following me, so I'd be able to connect with you and see the best recommended online. And you are looking, I think you had mentioned Zepbound, right? think that's what I read. Yeah, I will look. I would ask my friends and get back to you. Okay, yep, that's what I thought. I thought I read that somewhere. She said she would see if she could get it back.
My travel insurance is the same number as the team, so I can't order it.
She said she would check and see if she can get it back before the game. She just texted.
So I'm just saying I can't wear my travel jersey.
I know, but bring it with you because she said she would check to see.
I still can't wear it though.
Okay, then don't. All right. All right, guys. Thank you so much. I think I'm going to hop off now. I will try to come back. Kendra, you're back. Thank you for being here. I will try to come back again later today if I can. Thank you guys for joining me this long. It's been, how many hours have we been going here? Oh, a little bit over 2 hours. All right. It's great. I would go a little longer if I could. But yeah, I'm just trying to get our daughter ready and so we could get going. But I hope I've been able to answer questions, and I hope that this has been engaging and that you guys have learned from this live. I will try to come live again if I can. If I don't go live today, it'll be tomorrow, but I will try today. Thank you so very much. I appreciate each and every one of you. And remember, you can reach me even when I'm not live, right? You can send me a message. So I love you guys, and I'll see you soon. Bye.